Welcome once again to the AAPA Quick Case for the month. My name is Aaron Bright from the AAPA PANCE PANRE Review and Hippo Education. The idea here is to give you a case-based question, board style, and help you learn a little bit. I have lots of my good friends here. I have John Mabey.
Hi there.
I have the famous Kim Caston.
That's why I'm here.
And the famous Jill Tanner.
Glad to be here.
And I have Tom Wolfson, who is not a medical professional and should not be listened to. Let's get to the question. Are you ready?
Yes.
I'm so
We're
ready.
all ready. A 13-year-old boy is brought to the office by his mother because he has had pain in his right knee for the past week. The pain most often occurs when he runs or jumps and is relieved with rest. He denies any trauma. On physical exam, there is prominence and tenderness over the right tibial tuberosity. Range of motion of the knee is normal, and there is no crepitus, there's no locking. Which of the following is most likely diagnosis? So before we even look at those answers, as we usually try to do if the question lends itself this way, kind of cover up the answer choices, there's some stuff in here that kind of makes me think of certain diagnoses. So let's go
Absolutely.
through that. So we've got a couple of key features. What do we think the key features are on this presentation?
Ooh, you know,
13-year-old boy.
13-year-old boy, so we got age,
yeah, I
Right?
look at that right tibial tuberosity,
right tibial tuberosity. That sounds like a good piece of information.
and there's no trauma.
No trauma, relieved with rest. So we might even know the answer there.
Look,
We'll-
where's that right tibial tuberosity?
That's right tibial
Dr.
tuberosity.
Bright.
Would you like to know where the right tibial tuberosity is?
I would like to know where the right tibial
I'd like
What
to
you
know.
do is you take your patient and you just sort of take them like this and you boop right in here and you bang on it. That's
There
the
it
tibial
is.
tuberosity. Ow, you say, ow, ow, ow. That's what you're going to see is something kind of like
Is there
that.
tenderness there?
All right, now
Some tenderness.
let's go through the answer choices. We have A, chondromalacia patella. We have Osgood-Schlatter syndrome. We have osteochondritis dissecans. We have osteochondroma, and we have patellar tendonitis. So, John, let's go through those one by one. Chondromalacia patella. Do we think that's what we're dealing with here?
I don't think so. Chondromalacia patellis, so that's something where you get like actually discrete anterior knee pain. There's some locking or crepitance that you get when you try to move that patella around.
All right. Very
Nothing in
good.
the stem that gives you that.
All right. Osgood-Schlatter.
Oh, what do you
Ooh,
guys
that sounds
think?
like a good
Sounds
one.
very likely.
Yeah.
I'm liking this one.
Osteochondritis dissecans.
So this one is a process where we end up with a flake of cortex that ends up being like oftentimes enters the joint space. You get like
Yep.
some locking, some sticking or crepitance again
Right.
with the joints, so we don't see any of that.
Don't see any of that. Osteochondroma.
Oh, one of those omas, osteochondroma. So this is actually a benign tumor that comes off the bones, typically around like a physeal area. So you can actually have a mass with this one, but we don't see any description of that in the stem. So pretty unlikely.
Yep. And patellar tendonitis.
Yeah, this is kind of close, right? You're thinking, where is that tenderness specifically? So again, when you take a look at the stem, we see that point tenderness directly over that right tibial tuberosity.
Yep.
I mean, with a patellar tendonitis, you can certainly get some tenderness there, but oftentimes that's by the inferior pole of patella. And when we take a look at this vignette, there's enough information there that really kind of points you to what do we think the answer is going to be here then?
Yep. So I'd say we don't talk ourselves out of it. We think this thing is the tibial tuberosity is the key, and that is Osgood-Schlatter. You just kind of have to memorize that. It's unfortunate.
Right.
These people name diseases after themselves. This should be called tenderness tibial tuberosityitis, but
There you
we
go.
don't have that luxury.
So we got to go with Osgood-Schlatter.
Let's
in
do
that
it.
case.
Let's go with Osgood-Schlatter. Let's check our answer. We are correct.
Yes.
We are so good at this. I'll tell you what.
All
We should
right.
do this for a living. As usual, you get the answer, the explanation of the correct answer, and all the incorrect answers for you to sort of understand the foils, just like John went through. And I think this is a pretty typical question. Again, make sure you're answering the question that's asked. Don't talk yourself out of your gut. Anything else we need to add here?
I think we're good.
That's a good one.
Trust your instincts.
So thanks again. And that is it for this month's AAPA Quick Case. We will see you again. Bye-bye.